Hello everyone. Today we are going to discuss the bone clavicle. Okay. So first we will learn how to tell its side. That which side it belongs to. Either left side or right side. Okay. So before that we have to see that a lateral side is there and the medial side is there. Okay. So if we will see, the lateral side of clavicle is flat. Okay. See as flat, whereas the medial side is not. Okay, so the lateral side is also called as acromial end, which is flattened, and the medial side is enlarged. Okay, and is quadrilateral. See, this is quadrilateral. Okay, now we will determine the side, that which side it belongs to. So see, median two-third path should be convex from front. Okay, that means that if you are watching this clavicle, it should be like convex, and lateral one-third part should be concave. But from my side, if I am watching the clavicle, it should be concave. Medial two-third part should be concave and lateral one-third part should be convex. Okay, so that depends that from which side you are watching this. So during exam you have to take care of the side. So as this is my medial two-third portion, which is convex from front, and lateral one-third is concave from front, so it is a left side clavicle. All right, left side clavicle. We can touch our clavicle, right? It is cutaneous. Now we have to see some points. So this is a beauty bone. It is the only bone that lies horizontal. So ये इस वजह से थोड़ा खास भी है. That's why it is somewhat special for us. It has no medullary cavity. It is subcutaneous. It is the first bone to start ossifying and the last bone to complete its ossification. Okay, so now we will see parts. So as I told, the shaft is medially two-third portion is convex from front and lateral one-third is concave. So we can see that it has four surfaces. One is anterior, if the bone will be like this. One is anterior, which will be facing forward. The back side we call it as posterior. Okay, this is the back side which we call as posterior. One is superior. Okay, superior, and one is inferior. So the top view, if we will see the bone from top view, what the surface will get is superior surface. From below, bottom view, we will get inferior surface. From front view we will get anterior surface, and from back view, okay, opposite to the front view, we will get posterior surface. First talk about anterior surface. So two muscles attaches. One is pectoralis major muscle, which attaches to the medial two-third part, okay, from the medial end. This is the lateral end or acromial end, and this is the medial end. Okay, this is the medial end and this is the lateral end. So here pectoralis major will attach, and to the lateral end deltoid muscle will attach. Okay, from anterior surface, medially pectoralis major and laterally deltoid muscle. As we know, pectoralis major origin is medial head of clavicle and sternum, lateral end of sternum, right? Okay. After anterior portion or anterior surface, we will talk about superior surface. So as you can see, superior surface, this is the acromial end. Okay. Now this is the medial end. So in medial end, sternocleidomastoid muscle joins. Okay, attaches. So medially, sternocleidomastoid muscle joins or attaches, whereas in lateral, scapula attaches. Scapula. Portion is called as acromial end because the acromial process of the scapula attaches to the lateral portion, okay, from superior lateral portion of clavicle. Now we will discuss about posterior portion, okay. Opposite to anterior, it is posterior. So medially, sternohyoid muscle attaches. In the middle portion, there is nutrient foramen. If you can see here, this rectangular, I have marked from rectangular shape. This is nutrient foramen. Okay. Then there is one conoid tubercle. This portion. There is one part which is bulged out. This is called conoid tubercle, where coracoclavicular ligament joins. And in lateral portion, trapezius muscle attaches. Now we will talk about inferior surface. So as you can see, there is one subclavian groove. Okay, this is the groove which is named as subclavian groove. So here in subclavian groove, subclavius muscle attaches. In subclavian groove, subclavius muscle attaches, and from the lip of the groove, or we can say the edge of the groove, okay, from the edge of the groove, clavipectoralis fascia arises. Now there is one more portion in the medial end where costoclavicular ligament attaches. Medial, here, from here, this portion, okay, costoclavicular ligament attaches. The lateral end, this is the quadrangular portion. Here, there is sternoclavicular joint because the clavicle, sternoclavicular means the clavicle joins to the sternum. Okay, so the clavicle joins to the sternum. If I keep like this, the sternum is here and this is the clavicle. So here it is sternoclavicular joint. Revise clavicle once again. So it has medial 2/3 portion which is convex from front and lateral 1/3 concave from front. In anterior surface, medially pectoralis major originates and deltoid muscle attaches at the lateral end. In superior, there is sternocleidomastoid muscle attachment in the medial portion, and in lateral scapula attaches, that is from acromial end, that is acromial process attaches there. In posterior surface, sternohyoid muscle attaches medially, and there is one nutrient foramen present in the middle of the shaft. There is one conoid tubercle where coracoclavicular ligament joins. There is one trapezoid ridge in the inferior surface, okay, where the trapezius muscle joint attaches. And for inferior surface, medially, there is one space where costoclavicular ligament attaches. There is one subclavian groove where subclavius muscle attaches, and the edge of the subclavian groove attaches to the clavipectoralis fascia. So that's all for today. I hope you enjoyed. Thank you.